The Committee on Education and Labor will come to order for the purposes of conducting this hearing on child abuse, deceptive marketing by residential programs for teens. Last October, this committee heard from the parents of 3 children who died in private residential programs as a result of abuse and neglect they experienced at the hands of staff members. These stories these parents told left everyone in this room stunned, heartbroken, and angry. Bob Bacon testified program staff members mocked his son Aaron when the 16-year-old boy asked for medical help, calling him a faker. For weeks, the staff deprived Aaron of adequate food and water, even when his weight loss became frighteningly apparent. Cynthia Harvey told the committee of a program staff members waited 45 minutes before summoning appropriate medical care for her daughter Erica, who had collapsed and was having difficult breathing. Paul Lewis testified that program staff members ignored his son Ryan's obvious signs of emotional distress, denying him the psychiatric care that could have saved his life. In each of these cases, it was clear from the parents' testimony that the deaths of their children were preventable. Untrained, uncaring staff, reckless management, irresponsible operating practices permitted these horrible tragedies to occur. Sadly, the deaths of Aaron, Erica, and Ryan are not isolated cases. The Government Accountability Office found thousands of allegations of abuse and neglect in private residential homes for teens between 1990 and 2007. The abuses included staff members forcing members to remain in so-called stress positions for hours at a time, to undergo extreme physical exertion without food, water, or rest, and to eat their own vomit. The purpose of today's hearings is to gain a better overall understanding of the industry in which these types of abuses have been allowed in many cases to continue almost unchecked. Specifically, we will learn more about where these programs operate, the loose patchwork of state laws that govern them, and how they market themselves to parents. We will also discuss legislation that Congresswoman McCarthy and I have introduced to keep kids safe in these residential programs. Residential programs for teens, which come in a variety of forms, including therapeutic boarding schools, wilderness camps, boot camps, and behavior modification facilities, have sprung up in greater numbers since the 1990s. As we will hear today, a number of these programs use deceptive marketing practices to appeal to parents. They claim to be subject of independent inspections that never happen. They claim to offer services that don't, like schooling and transferable education credits. They assure parents that health insurance will cover the cost of their service, when in reality it won't. Programs are aided by these deceptions by their relationships with ancillary service providers like referral services. While referral services purport to offer independent advice to parents about which programs would be best for their children, the truth is that at least some of the referral services operate with significant conflicts of interest. This tangled web of deception, fraud, and conflicts of interest makes it extremely difficult for parents to judge whether any of these programs offer a safe, professional, high-quality environment for their children. We know that many of these programs and many people around the country who are committed to helping improve the lives of young people who do good work every day, but it is difficult for parents to tell the good programs from the bad, and that difference can be lethal. Making matters worse, some of these programs operate free of minimum standards of care. It is estimated that hundreds of programs operate nationwide with anywhere from no regulation whatsoever to some regulation. Even the information the states collect on many of these programs is limited. Indeed, a survey conducted by the GAO, state agencies in 45 states could not say whether or not a death had occurred at exclusively private residential programs for teens in 2006. The legislation that Congresswoman McCarthy and I have introduced will end the federal government's long-standing failure to address this nightmare of abuse and neglect. Our goal of this legislation is simple. We want to keep the children safe. This legislation will require the U.S. Department of Health and Human Services to establish minimum standards that all programs must meet, including prohibitions on physical and mental abuse of children and requirements that programs provide children with adequate food, water, and medical care. These standards will also include new training requirements for program staff members, including how to identify and report child abuse. The legislation will require Health and Human Services to set up a hotline for people to call to report abuse at these programs. It will also require Health and Human Services to create a website with information about each program so that parents can look to see if substantiated cases of abuse have occurred at the programs they are considering for their kids. The legislation will require Health and Human Services to enforce these standards by inspecting program facilities, and when there is a violation, by issuing civil penalties up to $50,000 per violation. Within 3 years, the legislation would call upon the states to take up this role of setting standards and enforcing them. We have an obligation to keep kids safe no matter what the settings they are in, and this legislation would take the first steps toward finally ending the horrific abuses that have gone on for far too long in some of these private residential programs for teens. We must treat this issue with the urgency it demands by acting on this legislation quickly. Individuals who have themselves lived through this abuse are at in the hearing room today, as are family members of abuse victims. I want to thank all of them for being here to remind us why this issue is so important, and I want to thank our witnesses. We appreciate that you took the time to be with us today, and we look forward to hearing your testimony.